If you can introduce yourself, like your name, your company,
It's Crystal, and my company is Aloha Pet Dental Care.
and how long you've been doing this.
13 years, but this is my 6th year of owning my own business.
What exactly do you do, and what's your steps?
This is just a maintenance service, so this would just be something either if a pet doesn't quite need an anesthetic dental or if they just had a consult, and this would be something between cleanings. First, I start with meet and greet, basically making sure the pet is open to meeting me, and put some of them in my lab and start to chart their mouth, so we'll get to that.
Okay. How do you know if the dog needs your type of teeth cleaning versus like the full-on anesthesia?
This is a non-medical procedure, so always consulting a vet first. But since he's really young, then we could always start with an assessment. And what I look for are any major issues, fractured teeth, loose teeth, pocketing, looking at the gums and kind of identifying it. So I'm not a veterinarian. I don't have a label for the medical field, but it would be something that I could identify if he was to have veterinary care. The only thing I don't do are x-rays, extractions, and deep cleaning.
Okay.
Where it would be like pocketing and things like that.
Do you recommend any products?
There's a lot of different things in the market, so I think brushing teeth is number one, in additional to sprays and things. But there is a brand made by I think it's Verbac. It's called CET, and so that's probably the most popular with veterinarians with what they sell for pets. Any kind of enzymatic toothpaste really is a poultry flavor, vanilla mint or salmon. So it is tasteful. So I would say CET is probably the most popular brand as far as toothpaste, and then following up with different rinses.
People ask for greenies, those type. That's just for the breath. That's not for removing plaque, right?
It can help with plaque control. However, sometimes when they bite on a greenie, it is ingested fully, then it's not really doing the purpose of removing the plaque, because we're supposed to gnaw on it, whereas some pets just kind of inhale the whole thing like a tree.
Yeah.
And so that kind of defeats the purpose of helping it with the breath and the plaque. But it's not going to remove anything that's already calcified.
Okay.
So plaque and tartar is two different things. Plaque is basically stuff that you can kind of move around. It's almost invisible to brown to yellow. And then the tartar is the calcified plaque. So that's dead bacteria. So that's what you see stuck on the teeth. That's kind of brown and yellow. So greenies, you're blocking the camera. Greenies, any kind of treats or even toothbrushing is not going to remove that tartar buildup. So that's going to need to be scaled off.
Okay. All right. Got a whole suitcase full.
Yes. So this is my work box. Protects all my equipment. So this is a piezo scaler. Basically, it is hooked up to a water tank. Once I press on the pedal, there's a tip that I put on here, and it will vibrate with water because it can get hot. So once it touches the enamel, it has water in the tip, so it doesn't hurt the tooth. And then I have a polisher here with polisher tips and paste used to smooth out any surfaces after scaling. And then hand scalers, curettes, and forceps.
Okay, are you ready, Charlie? You ready? You gotta go down here. You gotta go down.
Squeeze the slip lead to kind of keep them in my space. So it's good that you push me first.
So you're just kind of assessing.
Yeah.
Okay.
Engaging with him, letting him kind of hang out in my space.
Sure.
But with mom in the room, it might be a little bit different feels. But let me see if I can settle him down.
Yeah. He's pretty chill.
So basically, I just want to kind of look at his body, make sure, nothing's more hairy or off balance. Thanks. If you can just sit this way, turn. And go face the other way. Or that. So basically, I have this leg over him to kind of keep him comfortable. Yeah. So bigger dogs I would hold in this position, and then smaller dogs I would wrap using a towel or blanket. It's basically the whole position if they could sit still enough.
Yeah.
His gut color is really nice and healthy. Just checking for any loose teeth, anything out of the ordinary that jumps out. He feels really comfortable. It's pretty relaxing for most pets. The ones that are really excitable, or scared, it's different with the way, I handle them. If they're really, really stressed out or really scared and trying to bite, for instance, then I would actually turn them down. Working with sharp tools or head jerking, it becomes a safety issue.
Right, yeah.
So I want to make sure that they're safe and I'm safe. Give them breaks here and there, and then eventually they'll calm down. But for the ones that don't, I just don't continue.
So you don't have like a home base. You just go wherever your client lives.
So I'm based out, I do have a home base out in Oahu. I am mobile, and then I do travel inter-island as well. So I'm on Maui, Big Island, and soon to be Kauai, but I live here in Oahu. If there were, like I said, referring pets to different veterinarians on island, I do have experience working with veterinarians over island. So depending on what side of the island you're on, then I can refer you to the closest vet. He's sleeping. Good morning.
He's like, I can do this all day long.
Yeah, it's kind of like a spa treatment for them, Can you hear that crunchy? So that's all that hard tartar that's just kind of stuck on the enamel. Yeah, on the insides, they usually just kind of roll. Paper towels together. So this is good for especially like dogs that chomp down, or this way I can kind of control the head also, and then also see through on the back sides of the teeth. So kind of have to move their neck around a little bit, but I can see every single surface of the backs of the teeth.
He doesn't mind when I open his mouth up. So this is what his teeth looks like now. It's very white. It's usually this back teeth that gets really dirty easily. So we try to focus more on this part. And Crystal gave us this toothbrush. And we've been using this one. If you remember a short clip of Charlie getting his teeth cleaned when he was about 3-4 months old, it's this toothbrush. So we use this guy, fresh breath spray, couple sprays on each side of his mouth. We try to do that every day, and then this toothpaste. So dog has 42 teeth. And I think it's really important to make sure your dog is comfortable with you handling their mouth and for them not to growl. Good boy. boy. Good job.